the reason we use the silent epidemic as a metaphor is that because many of the complications we're talking about as being due to transfusions, such as postoperative bacterial infections and cancer recurrence, have long been attributed to either bad luck or surgical misadventure, when in fact they are due to transfusion, as far as we can tell. And so physicians in general have not been willing to accept that these complications are transfusion caused, although I think the evidence now is quite strong. Well, I can say for myself personally, there's a growing conviction on my part and some other physicians that more conservative use of blood will be associated with better clinical outcomes. And we actually have some very strong data now that that's the case. There is a growing body of data, but it's fairly small, suggesting that patients who get no transfusions or fewer transfusions actually have a better chance of avoiding complications and surviving even very severe illnesses. There are estimates that we've come up with based on our work and work in Europe suggesting that if we could avoid the complications of transfusion that we've been discussing, we might save as much as $6 to $12 billion nationally from our healthcare budget, which is about 1% of the national health budget. And in fact, this would be attended with better clinical results. So this seems almost too good to be true, but when you have fewer complications, you have shorter length of stay, and you have fewer hospitalizations and rehospitalizations, and you don't have to use as many drugs and procedures to treat the complications. So cost savings may be one part of reduction in morbidity.